Thank you, everyone. Thank you to Julie for inviting me to speak today. It's such a privilege. Obviously, patient experience is something that I'm really passionate about. Just to let you know, my background's nursing, so it's similar to Alan. Ironically, I was a nurse in intensive care for about 8 years, which is a bit bizarre because a lot of people get into intensive care because they don't like talking to patients. So a lot of them are intubated. And then ironically, I ended up in patient experience. I just wanted to share with you today some of the work that we've been doing at Northern Health. In particular, this is one of the things that I'm really passionate about and that really has connected with me, even though I've worked in the area of patient experience for a few years now. We've heard before from Julie and Alan that overview, that large picture perspective. So now I want to share a breakdown of that and some of the tangible aspects of that. Okay, so when you work in patient experience, people ask me, what do you do when I say I work in patient experience? And they think that I enjoy complaints. Oh, you work in the complaints department. No, it's a bit more than that. But complaints are obviously one part of that. Sometimes there are a lot of issues when you work in patient experience. When patients make a complaint, they're often reluctant to do so. As much as some of our staff or other people think that people like to complain, they actually don't. And the number of people that do complain are a small proportion of the people that are unsatisfied. The other issues about this are there's negativity associated with their feedback. So we actually want people to speak up. We talk about encouraging use of the F word, which is feedback. And so, like I said, we want people to speak up. How many of you have had a relative in hospital and you've gone to visit them and you ask them how things are going and they go, yeah, it's okay, but blah, blah, blah. And Tracy, yeah, very good. Just one person. Okay, and so it really highlights that people are reluctant to speak up. Oh, the nurses are busy, oh, I'll wait. But we really want people to speak up. And then there's also a concern from some of our patients that their complaints are dismissed. And I heard that earlier. Julie was mentioning about people and they ring up and they make a complaint and then there's just someone on the other end of the phone that sort of listens to them, but nothing really gets done about it. So we wanted to really tackle these issues. We wanted to get staff engaged in feedback and to change their mindset from just looking at complaints. We wanted to look at feedback and the value that comes out of the complaints. So we were changing that perception, and we also wanted to understand what's happening in our organisation. So the complaints information is really rich with data and really rich with useful information. So if we can really drill into that, we can find some really valuable things to improve our organisation. Okay, so this quote really forms the basis of what I'm talking about today. And it's, if a customer can tell a story for you, that is 10 or 100 times more powerful than doing it yourself. And as a result, I'm not going to do much talking for the rest of the presentation. I'm going to let the patients talk for themselves. So what we've done at Northern Health is we've started implementing patient stories. So what we've done, a lot of people have rang up, they've made a complaint, and as part of the resolution process, we've invited them to come in and to share their story, and we've filmed them. So we currently have a catalogue of over 30 stories. I'm going to show you some snippets of those today. So first of all, I've got Theresa's story. Like I said, I've worked in patient experience for a few years. When I joined Northern Health over a year ago, on my first day there, we were filming Theresa's story, and I remember I walked into the room. Theresa, as you'll see, is a very articulate, intelligent woman, and she had cancer. It went into remission, and then unfortunately her cancer came back. You'll see what the issue she had is in the video. But I remember that I stood there and I watched her from the corner of the room, and as she spoke, she talked for about 20 minutes. I remember getting goosebumps. And the thought that kept going through my head was, she can communicate this patient experience stuff better than I can. And I've been doing it for years. I've read all the books. I've done a lot of study in it. So it really emphasised to me the value in patient stories. So now I'm going to share Theresa's story with you.
A recommendation from me would certainly be to have some information about how the hospital operates for patients coming in and receiving services. For someone coming in from the outside, I don't know, and I don't care what the hierarchy is. I don't know what a resident is, or a registrar, or a consultant, a NUM. I don't know what all these labels are. I don't know how these people interact with one another. I need to know that once I come in, but there was no sort of general orientation, no information about how the actual hospital system works and how I interact with that as a patient. It's not a one-size-fits-all approach. It shouldn't be a one-size-fits-all approach. I know that there are some people who just come in here, hand their health over and say, you know, you tell me what I need to do. I don't want to know anything more about it. Then you've got people like me. I want to know everything. You know, my health is frankly my responsibility, my business, and nobody cares more about it than I do. I am the captain of this ship, right? You consultants, residents, NUMs, all the rest of you, you are talented crew members on my ship. That's how I'm seeing it, and I hope that you will see it that way too. I'm an intelligent person doing everything I can to survive. So I guess I would say, you know, put yourself in my shoes and think about, you know, how you would feel and what you would do in my set of circumstances.
Okay, so a few nods of the head there. Theresa's story was used for one of our co-design improvement activities, and we contacted her and told her how we were using her video, and she actually cried over the phone. It was really powerful. Unfortunately, Theresa passed away less than 5 months after that story was taken, and I think her words resonate still. They're still very powerful. There's a very universal theme there. And so, you know, I'm really indebted to Theresa for spending the time to share that with us. Okay, the other story is Russell's story. So we heard from Theresa, who obviously was a patient at Northern Health. Russell's story is slightly different in that he was a carer. So his father-in-law was the patient at Northern Health. I'm showing you this story in particular because it really highlights the importance of working with not only our patients, but also with their relatives and carers, and really harnessing the valuable information that they bring. Just to let you know, Russell is a paramedic, so obviously he's got experience in healthcare, and you'll see some of the issues he had from his story.
There was quite a lot of stuff happening. He wasn't exercising, so he was atrophying up, and our house is just a trip nightmare. It's got stairs. So we discussed that with the doctor who was actually caring for him in the ED, and we started to sort of work out a very basic cursory plan from there, the final part of which was going to be moving him, once he was stabilised, here to Beck and start rehab. And even up until the 23rd of December, he was going to move from here to Bundoora Extended Care. On the 24th, we got a phone call in the morning saying, can you come in and discuss Al's discharge with a discharge planner? And that's the way it was put to us, not can you come in and pick him up. And we just thought we were going to start arranging what he was going to do and move to Beck. We come in to be told very briefly by the discharge planner that physio's decided that he's right to go and he's going to be going home on that day. Then the physio came in and said, and I asked him, so what's his take? And he said, well, he's getting around quite well. And I asked for it, define quite well for me. And he said, well, he can walk from the bed to the toilet and back without assistance, which was all of 5 metres. And I said, well, it's really not appropriate. We've got a house that is just full of stairs, and he's still atrophied up. He's still got no muscle tone, and his lungs are still bad. And the response we got from the physio, well, the decision's been made that he's okay to discharge, so we will be discharging him. Then the doctor came out and he started giving us a rundown of what the discharge, and I pretty much said, well, hey, has he had a respiratory consult? The answer was no. I said, has he had his mental health consult? The answer was no. I said, well, what happened to the idea of sending him to Beck?
We've got some technical issues there. So obviously Russell was trying to communicate some of these potential issues with his father-in-law's discharge, and he felt like they weren't being heard or taken seriously by the staff. So what ended up happening was that his father-in-law was discharged. It was on Christmas Eve, and he said how it took 20 minutes for the father-in-law to get down the driveway and how terrible it was when he got in there. Obviously, it's very different doing an assessment in a hospital when you're asking people to walk 5 metres down a corridor versus when they go home, and the setting's very different. So then we asked Russell to participate in an improvement activity, and he joined a focus group of people, and here is his after story.
When I got asked to come and do these sessions or come and assist with this, again it was such a great acknowledgement of what needed to be fixed. But hopefully the outcome we're going to get at the end with changes in documentations and process and communication will give us less of these sort of issues. When we came in on the Wednesday, it was, okay, this is what we've done all day, how can you now help us? And so we gave our feedback, and then we all came in again yesterday, and then they developed the new forms and the new process, and pretty much everything that we'd highlighted had been addressed. To see the organisation put patient outcomes and even carer outcomes as such a high priority, it was very, very good. And so now as a user, to see such a poor experience taken so seriously and handled so well, I would always be happy to recommend the Northern.
Okay, so I've got one final story to share for you, and that's Faye's story. Fortunately, we've got Faye here today. She's made time to come and speak with us. I'll play her story, and then I'll get Faye to come and speak with the group.
Then at 7:45, a doctor called me into, a young doctor, a male, called me into a corridor, and my son and daughter-in-law followed, and he said, do you want to, or will you put do not resus on Lance's papers? I looked at him, I looked at the kids, I don't know where that come from. I want everything medically done, and because we don't know what's wrong with him. I've got this spinning in my head, do not resus. The same lady doctor from the day before called me into the corridor. We were just outside near the nurses' station, people going by, talk and everything, and she turned around and said, the oncology team have said that Lance has got weeks left to live. My jaw would have hit the floor. I know that my knees buckled, so I moved towards the wall to hold me up. And I didn't understand it, and I just looked at her. I don't know if I said anything to her, because first of all I was in a really busy corridor. I couldn't cry. I still didn't know exactly what was wrong, but now I've been told, and I've got to tell the boys that, I've just been told Dad's got weeks left to live. And what's weeks? Is that 2 weeks? 6 weeks? It meant nothing. If we had been told the truth from the minute the first CT scan was done, then we could have asked questions. We couldn't ask questions. Everything just happened so fast. We went from 3 lesions and possible infection to do not resus to it looks like cancer, but I'm not an oncologist, to some bloody team has decided that Lance has weeks left to live. What does that mean? How is he going to die? Why is he going to die? Lance passed away on the 6th of May, so 25 days from the time he collapsed. When Lance went to palliative care, the boys said, we don't know what's going on because we didn't know what was wrong with him. Can we take Dad fishing? He always loved fishing. And I said to the kids, look, let's wait till we know really what someone's got to tell us. And I stopped my boys taking the Dad out, and he didn't live long enough to ever go out because nobody told us what was wrong with Lance. And I've had the guilt that I stopped them having a day out with their dad doing something that they love, because they love their dad. I could have prepared myself maybe a bit better. You can't ever be 100% prepared, I understand that. but I would have understood the situation. Wasn't Lace worth looking after? Wasn't it worth them spending 10 minutes to explain things to me? And I've got to put my life. I was angry because I requested he comes here because they've got their records, I trust them, they've always looked after us, but they let me down. And then I stopped the boys having a day with their dad. They can't get that back.
Just to let you know, today is the first anniversary of Lance's death. So it meant so much to Faye that she agreed to come here today, and I'm so indebted to you for doing that. Your story breaks my heart, and even editing it, the first time you've seen it.
I haven't been able to look at it.
So thank you. I just wanted to know from your perspective about how you found the experience of making your video, because Faye actually had written in and complained about the care of her husband, and then she filmed the story as a result.
To make the video, all I wanted to do is prevent this happening to another family. The heartbreak is real, it is still there. So it's for people to listen and understand, to spend a little bit of time with families. It's very important regardless. And if you're going to say something, make sure you give them the details in labour terms. Or layman, sorry. A little bit nervous.
Yeah, that's okay. As you're watching these videos, well, when I watch them, a common theme keeps coming through, and it's often about communication. You saw it in Faye's video, you saw it in Russell's video. He didn't feel like he was being listened to. And again in Theresa's video, she wanted that communication, she wanted that relationship, which comes back to what Julie was talking about earlier. It's about building these trusting, nurturing relationships, and that's what we need to be doing. So thank you, Faye. Thank you. Okay, so just quickly, here's a quote from John Cotter. Anyone that's studied pretty much anything about business or about change knows about Cotter. And the quote is, "Over the years, I've become convinced that we learn best and change from hearing stories that strike a chord within us. Those in leadership positions who fail to grasp or use the power of stories risk failure for their companies and for themselves." So the use of patient stories or customer stories is readily known, in the business world, and it's becoming more well known in healthcare. Okay, just quickly, obviously we use it to drive improvement activities. So we show a lot of these stories, particularly for staff training. And the value is that it really hits home. It communicates the message better than I could, and it really helps with engaging our staff. Okay, so my message to you is to think about your patient stories. Every patient has a story. You don't necessarily have to film a video about it, but just changing that mindset, thinking about what's happening for them, and not only for the patients, but for their families as well. Okay, so we also film complaints, compliments, sorry. So we have a lot of positivity happening in our organisation. There's a lot of great things that happen, and it's important to really capture that and to share those bright spots with the rest of the organisation. So for the final video today, I'm just going to show you a brief snippet of some of the positive comments that came out from our patients.
The nurses were unbelievable. I've been here a few times for different reasons, and the care that they took to look after me, I can't fault it at all.
We must be running a bit late, so that's all right, we'll cut that one off. But just as a final word, I just want to express my gratitude. The end of the video actually had credits, and it showed, the 30 plus people that have shared their story. There's people coming in their own time, and it's for our benefit and for the benefit of future patients and their families that they do that. So hopefully this presentation's helped to emphasise why experience matters. When I was going through this presentation, I was showing my mum. It sounds a bit odd from a 35-year-old, but mothers know best. And she watched it, and she had tears in her eyes at the end of it, and she said, now I finally understand why you're so passionate about what you do. So hopefully I've shared that with you today. And as a final thought, think about, what is your patient story? Thank you.